Please introduce yourself and identify the graduate specialty track that is of interest to you.
My name is Raven Howell. I am a nurse practitioner at The Ohio State University on the neurovascular service. I am also a senior partner and a substance abuse provider at Quest Recovery Center in Mount Vernon, Ohio. I'm applying for the Psych Mental Health Nurse Practitioner certificate, postmasters. I'm doing this to better understand the population that I serve. My ultimate goal is to provide mental health services for the rural areas in Ohio. A little bit about myself. I'm originally from Fort Worth, Texas. Go Cowboys. And I went to Ohio State for undergrad and graduate school. I graduated the first time with a BS in health management from the College of Allied Medicine. Then I worked at Ohio State as a family care coordinator under the direction of Beth Steinberg. In that role, I found my love for nursing. So I applied for the graduate entry program at The Ohio State University in 2012, and I graduated that program in 2016. In August of 2016, I started on the neurovascular service at The Ohio State University and loved it. I still work there PRN. So the question is, how does someone who has an acute care nurse practitioner background go into addiction medicine? And stroke, a lot of times we see people that stroke, but stroke is a disease that you see in an older population. Young people are not supposed to stroke. In 2017, there was a dramatic increase of the patient population that I was seeing that were stroking, but they were 30 or younger. Typically, you don't see that in stroke unless someone has an autoimmune disease. So what I was finding is I go down to the ER and I would see a scan, get a scan, and they would have a hemorrhagic stroke. I'd have to send them to neurosurgery for hemicranie. A lot of times, these patients were presenting as overdose from heroin, meth, illicit drugs. And by the time that they got to me, I almost felt like it was too late. I didn't feel like I was really helping the problem. I wasn't even preventing the problem. So I started looking at jobs in addiction medicine. I also have had family members who have personally suffered from addiction, so I already had kind of a passion for people that suffer from addiction. So in that, I started working for Pinnacle Health Systems, and I absolutely loved it. I loved seeing people get their lives back, get their homes back, get their kids back, really truly recover from active addiction. In 2019, Pinnacle decided to close their doors in Mount Vernon. I came home one day super upset just because I had made a connection in Mount Vernon, serving the community. I had made friends with people that worked at the Freedom Center, people that worked at Riverside, and most importantly, I had made this connection with my patients. I expressed this to my husband. He said, why don't you just open up your own clinic? I actually laughed in his face because as a nurse practitioner in the state of Ohio, you have to work under a physician. And I was like, there's no way that I would be able to find a physician, get the malpractice insurance. I'm listing all the things that would be a contraindication as to why I could personally open up a practice. I woke up the next morning around 5 a.m. to get ready for the day, get my daughter ready for the day, and my husband had a whole business plan laid out on how I was going to open up a practice, who I needed to talk to, and what funding I needed to get. The following week, I went to Pinnacle and I was talking to one of the collaborating physicians I had worked with about this idea. He expressed that he would be my medical director. He said that, Raven, I've really liked the passion that you have for the patients that we serve, and I'd be more than happy to be your medical director. I had a coworker who I went to school with at Ohio State that also had started working at Pinnacle and decided that he would come along with me as well and be a partner and also help with the practice. So that's what I did. I started along with my husband and my business partner, we opened up Quest Recovery Center in Mount Vernon, Ohio. We opened our doors March 1st of 2020, and we love it. There's nothing. I do this full time. It's nothing more rewarding to just be on the journey with someone as they're recovering from addiction, which has stolen so much of their life. What I found, though, as I am working in this population, that mental health and addiction go hand in hand. And I am really having a hard time getting my patients the mental health resources that they need, especially in rural Ohio. As I started talking to other nurse practitioners, specifically in addiction medicine and mental health, this is a huge need. There is a huge need for mental health services in rural Ohio, and there's just not enough resources for the clientele that needs it. So my ultimate goal is to hopefully get into a postmaster's psych mental health nurse practitioner program and be able to provide mental health to rural Ohio, because those people, there's a gap, and I don't feel like there's really much resources or help that they can get in the community. And I think that's a really sad phenomenon that's happening. So that is my goal. After completing my postmaster's in mental health, my goal is to go on for my DNP for nursing leadership. I think as nurses, sometimes we don't know how much we really can do. Sometimes we don't know the extent to what kind of things or passions that we even have that we could be helping the community. And so my ultimate goal is to inspire other people to kind of just take that leap of faith. If you have an idea, if you think you're passionate about something, just go ahead and jump and do it. So after the postmasters, my goal is to go on to get my DNP. So thank you for your time. Thank you for considering me for your postmasters program.